Hi, my name is Saina Adaran, and I practice at Gilbert in Arizona.
Does vein treatment increase the risk of DVT?
In general, any procedure on the legs or even anywhere in the body can increase the risk of deep vein thrombosis. Treating the superficial veins in long term should allow to decrease deep vein thrombosis in general, but during the time of the treatment, there is a slight increase, for which we will make sure that the patients are mobile and also they are hydrating well. And sometimes we ask them to take baby aspirin. Depends on their age and the risk factors.
What can I do to avoid DVT if I have vein issues?
It depends. First of all, we really need to diagnose what kind of vein issues the patient has. If it is an old DVT causing post-thrombotic syndrome, and or the patient might have just venous incompetence, which could be on the superficial veins or the deep veins. So all of them needs to be diagnosed first, and for that we will do an ultrasound to find out exactly the anatomy, the pathology before and the current pathology of the patient. And then based on that, we can advise them.
What signs and symptoms of DVT should I watch out for?
One of them is pain and tenderness. Sometimes there's swelling and also redness in the affected limb. And sometimes this can be asymptomatic, but in general, it is important to make sure that the calf muscle is not stretching or tender. And if it is, it's always good to have it ruled out as soon as possible.
What is the risk of developing PE after a DVT?
Again, it all depends on the size and the location of the DVT and underlying conditions. The risk is small in somebody who has got the first time DVT, only a small one in a calf muscle, but it increases as the clot is located more centrally, like in popliteal or femoral veins or in iliac veins, which are inside the abdomen. Also, as we get older, with all the comorbidities, the risk of PE increases. If the patient has been immobile or on a flight, again, the risk can increase. In general, there is a small risk, but it varies from patient to patient.
Are there any medications I can take to prevent and treat DVT?
To prevent, yes, hydration, mobilization, and like exercise, all of that can prevent from developing DVT. Also, sometimes baby aspirin can help with that. Depends if it's the first time or not. Patient has got recurrent DVTs. If the patient has DVT already, the treatment is again different. We have to diagnose whether it's acute or chronic. For the acute DVT, yes, medications such as Eliquis or Xarelto are prescribed. And if it is a recurrent DVT and the patient should be on lifetime and anticoagulation, warfarin also can be an option.
Any other advice that you can give patients about their risk of DVT?
Yes, be mindful of the symptoms. Try to wear your compressions when you are taking vacation. If you're in the car, make sure you have frequent stops and walk for 10 minutes. If you're on a plane, make sure you get up and walk after every hour for a few minutes. They will prevent or at least decrease the risk of developing DVT. Make sure you're well hydrated. Even if you are in a sitting position, make sure you move your legs. All of them can help you prevent. And if you have concerns or see any sign of DVT, make sure you go to a vein center and have the ultrasound. If you don't have a vein center available or close by, go to ER. Don't take a chance.